Hey, it's Dr. Carling here from the Carling Adrenal Center. The Endocrine Society's 2025 guidelines on primary aldosteronism, PA, or also Con syndrome, were just published in JCEM, the Journal of Clinical Endocrinology and Metabolism. And it tackles a major cause of high blood pressure due to excess aldosterone. And PA affects 5 to 14% of all patients with high blood pressure, and it raises the risk of strokes, heart attacks, kidney damage, and so forth. And now these new published guidelines finally endorse screening for this disease of all patients with high blood pressure. Everybody should be screened for PA, a practice that we've been championing for decades. And a simple aldosterone and renin ratio, the ARR test, has a 97% sensitivity and 94% specificity. So it catches PA ideally early, and it enables treatments like our 20-minute mini back scope adrenalectomy to prevent complications. But in the guidelines, the diagnostic process is still too complex. So it's relying on what we call confirmatory testing that almost no patients need, and they advocate for adrenal vein sampling, which is not available to many patients for all patients. As you know, who has followed this, some patients do need adrenal vein sampling, but far from everybody. So we propose a simpler path. So 2 lab tests showing elevated aldosterone and a suppressed renin or an elevated ARR, and then move on to CT scan. So for unilateral adenomas, especially in younger patients or those or women or those with severe PA, so those with very high aldosterone, they can go straight to surgery and skip all these extra steps. Also, the guidelines miss highlighting function-preserving adrenalectomy, which saves healthy tissue and then reduce lifelong medication needs. So it also underemphasizes surgery for bilateral PA, despite evidence now that it can outperform just medical management, one blood pressure medication after another for life. So at the Carling Adrenal Center, we perform over 600 adrenal operations yearly, and we tailor each treatment to each individual patient based on their unique circumstances. So if you have high blood pressure or you suspect PA or Con syndrome, discuss your case with me and we can explore cutting-edge personalized treatment options.